Good afternoon to everyone. Uh, uh, Distinguished key speaker, Dr. Derek Lomas, Dr. Omkar Rai, DG STPI, and other participants. I welcome everyone for this session, STPI Pulse, on the topic artificial intelligence for well-being. I take it is a privilege for me and a pride for me to open this particular session today on AI for well-being. And through this session, I also welcome my two distinguished speakers, Dr. Derek Loma and Dr. Omkar Rai. And as the topic of the session is artificial intelligence for well-being, or you can say artificial intelligence for healthcare sector. So I would like to listen the views of two speakers today, uh, along with participants on this topic. And in the present this pandemic COVID-19 situation, we know this artificial intelligence as well as this medical field has to play a very important role, and we cannot underestimate the role of artificial intelligence in healthcare sector. In fact, artificial intelligence being part of computer science can be effectively utilized to enhance the ability and capability of the medical experts for understanding day-to-day pattern and giving feedback guidance in their field. Uh, Meaningful relationship between data sets of AI can also provide productive kind of treatment where diagnosis and treatment can be further enhanced for the betterment of the society. Uh, and this AI has not only a role to play in development of application in the field of medical sciences, but it has also a very important role in the development of hardware devices, wherein it can develop devices where contactless kind of devices where human touch is either minimum or zero. Uh, with this, I just want to mention here that as per some global news wire statistics, that this AI market in medicine, or you can say medical field, was about 2.25 billion US dollar in 2018, which is expected to touch about 17 billion US dollar by 2024 with a CAGR of 40%. Taking all these factors into account, STPI has taken decision to set up a center of excellence on this Meditech devices in one of the city in Lucknow, with collaboration with one leading hospital of India, Sanjay Gandhi Postgraduate Medical Sciences, and central government, UP government, Medical Devices Association, and AMTZ. It is one organization of one of our provinces in Andhra Pradesh. And this center we have already, or you can say the approval of this center has already been obtained way back in September 2019, and very soon we are going to launch this center, where we are expecting that some startup who will be working in the area of health informatics and medical devices, they will also use this artificial intelligence in their product development or application development. With this, now I come to the speaker and invite first Dr. Omkar Rai to give his views, as he is a very enthusiastic and his zeal has initiated this particular concept or particular initiative in STPI to set up this center of excellences across the country, in which this MediTech devices one of the center, which in fact was initiated through his only initiation, as he is very much, you can say, interested, or he is very much keen, you can say, scholar of statistics, where healthcare data can be used for in this particular center of excellences. Before handing over this session to Dr. Onkar Rai, I would like to read his brief profile for the benefit of the audience and speaker. Dr. Onkar Rai is Director General Software Technology Parks of India, which is the premier government organization working for the promotion of IT, ITS, ESDM industry in India. Dr. Rai has contributed immensely in repositioning STPI with focus on innovation and dispersal of IT, ESDM industry beyond metros. He brings over 25 years of experience in IT, ESDM sector, having unique distinction of working very closely with government and IT, ESDM industry. He has been instrumental in formulating an appropriate interface among industry, academia and IT, ESDM industry. He is working for the formulation of incubation program and center of excellences for IT, ESDM sector to promote startups, entrepreneurship, innovation and software product creation in the country. Before joining STPI, he served National Informatics Center in various capacities. He is also serving as Chairman AIC STPI Next Initiative, Director on the Board of Directors of MTNL STPI IT Services Limited, Haryana State Electronics Development Corporation Limited, Chairman of IT and ITES Sectional Committee of Bureau of Indian Standards. He is the member of governing body of School of Open Learning, Delhi University, Board of Governors for the International Institute of Information Technology, University Bhubaneswar, Executive Council of Sri Vishwakarma Skill University, Standing Committee of Council of Triple ITs and Coordination Forum of Triple ITs, Triple P of MHRD, Government of India. Dr. Rai has published with various leading journals, magazines, newspapers, and given interview sessions with leading newspapers and news channels. Dr. Rai has led several delegations of Indian IT, ITS, ESDM industry to the industry and innovation centers of the world. For his outstanding contributions in bringing transformative changes in IT industry, GLA University has confirmed the DSC on Dr. Rai, and Indian Express Group has also conferred the Digital Icon Award on Dr. Rai. Dr. Rai has been educated in Banaras Hindu University, from where he earned his bachelor's, master's and PhD in statistics. For his enormous contribution towards exemplifying the vision of Mahamana Pandit Madan Mohan Malviya in public fora, BUHU has conferred the Distinguished Alumnus Award on Dr. Rai. This is about briefly about Dr. Rai, and now I hand over the session to Dr. Rai and would like to listen his views on this on the role of artificial intelligence for the ease of making life smooth and developing new devices vis-a-vis this pandemic COVID-19 situation. Over to Dr. Rai. Thank you.
Thank you, Rajnish Agrawal ji, my colleague, for inviting me for this very great session, AI for Wellbeing, in presence of learned Professor Dr. Derek Lomas, who is an expert in the field of AI, uses of AI in the healthcare, diagnostics and all. And I'm very glad that I would be, benefited from his speech, his talk on this topic subsequently. Rajneesh Agrawal, my colleague, has entrusted me the task of introducing this very important topic, very you know uh, relevant topic of today in the Indian context. I am very sure that we all know that the technology like artificial intelligence, machine learning, and associated technologies are playing a very important role in preventive healthcare, diagnostic, and saving a lot of lives, a lot of wealth that was being wasted because of lack of analysis in the medical data, health data. We know that the point of contact like hospital and laboratories and doctors, lot of information, a lot of conversation happens between a patient and doctor, and that information is lost unless a doctor creates a kind of scribes it on a piece of paper. The technology has made a lot of difference in terms of conversational history recording and analyzing that and getting intelligence out of it. In this process, if all the point of contacts, doctors, hospitals, pathological laboratories, diagnostic laboratories, if all are AI enabled with a platform and a pan national data grid is created, definitely we will be able to gather, collect, collate a lot of defined data, formatted data, which can be used by AI and machine learning to generate a lot of intelligence out of it, to predict things beforehand, to analyze things intelligently, and getting the intelligence out of it, using it for the well-being of the people at large, society at large, patients at large. And that is why of late these emerging technologies like AI, ML, robotics, basically this NLP, all these technologies have assumed a huge, a very important importance in the area of healthcare. And therefore, in times to come, the way the things are growing, it won't be possible to keep the technology away from the healthcare and medical technologies. And therefore, if you look at the kind of uses that AI, ML, and NLPs they are doing in terms of basically around diagnostic data, around medical imaging data, this contribution, this kind of technology, the contribution is being acknowledged by the medical practitioner and the planners of any country in that context. We know that because of this very importance and usefulness of these technologies, IBM Watson came up with the technology. This is being used largely by the researchers and medical practitioners. We know that huge data is stored in terms of X-rays, CT scan, MRIs, and all. And this is the data which is actually the very reliable data, and it is being trained. And these technologies are getting improved every moment that we are feeding with this system with the data. And therefore, if we look at the whole scenario in the context of India, of late, within India also, there are certain success stories in terms of certain startups who have come up by using the data, training the data through AI tools, and helping the hospitals, pathology, and other policy planners to make sure that the lot of preventive healthcare is taken, early detection of cancer, early detection of breast cancer. All these things are happening because of a very proactive and intelligent use of these modern technology that are available to us. We also know that AWS, Amazon has also created a platform. IBM Watson platform is so famous. Thereafter, we all know that this it's very important for us to make sure that we capture all the data, and therefore, at a point of contact, it is time. It's necessary for us to equip the whole thing in such a manner that even a fraction of data, a small data, is not lost. And therefore, as soon as a patient walks in or a doctor approaches a patient, in whatever scenario, we must create a platform, a system by which we are able to gather each and every data that comes up, that generated not only from the interaction between a doctor or patient or a pathologist between patient, but also all the data that has to be generated while processing of a patient over a period of time. So that's very important, and that is the need of the day. Unless we have a huge, credible, formatted data in our hand, which can be exchanged, which can be interoperable, which can be accessed by the people, which can even be brought on the cloud, and anonymized data can be put on place so that the researchers can use and develop finest and finest of algorithm intelligence out of it. We also know that, as I said, the India startup ecosystem has started doing things around it. We also know that Nirmay kind of startup, which is around breast cancer, early detection of breast cancer, portable cancer screening tools they have developed, and it is being used by some of the hospitals, and they are getting a lot of data around it. I'm sure that in times to come, as soon as they start getting huge data, their tools and technology algorithms will become finer and finer over a period of time. We also know that another startup, which is known Haptic.ai. Actually, if we talk about Arogya Setu app that India has launched, we know that about 12.69, about 126.9 million users are there. And this is a huge number, and this number is growing rapidly over a period of time. And I'm very sure that we will be around 0.5 billion users in another few months. This data is actually powered and analyzed by Haptic.ai platform. And this is a kind of data which is not only network data, which allows patients to understand whether they are getting close to or getting in contact with the COVID-19 potential infectee or patient. But it anonymized data which is being stored on this Arogya Setu can be a great source for India to develop a lot of tools and technologies and algorithm and insight on the kind of data we have in doing so many things proactively, to forecast things, to predict things, and to understand the patterns that are there. And obviously, all these technologies like AI, ML, and all these things have to be used properly. We also know that another two startups like i3 systems, they are actually doing a lot of good work in terms of insurance claims and insurance processing. At the time of admission of a patient, they are using a lot of AI in the background about how much premium you have to pay. You have to pay what kind of premium you have to have, what kind of coverage you should have, based on your data, and also based on the intelligence that they have from other data that was so far been developed, generated, and used. I would say within India, a lot of work has to be done. We are a huge population, 1.36 billion people, with a lot of rural areas and a lot of proactive community health has to be taken care of. And there we need uses of technology to the extent that we save a lot of huge amount of money, huge amount of effort and wealth, which is being wasted in terms of post admission healthcare. So we have to prevent a kind of generation of the diseases, early detection, to make sure that we not only help the patient, but we also help this nation save some money. We also know that by using, as per McKinsey report, by using AI as a tool, 100 billion annual saving is projected in medicine and pharma by using AI, big data, and all. It's a huge number. This, I think, this saving amount of this saving year on year will grow, and therefore the usage of technology is so important, not only to the save lives, not only to early detection of the diseases, but also to save a huge wealth that are being vested in healthcare, and to put that use that money towards education, towards nutrition, towards wellness and all. I would say that we have reached to a point. Indian startup ecosystem has reached to a point. We are third largest startup ecosystem in the entire world. We have a huge IT services industry of India, which is actually a R&D industry, which is doing R&D as a service, and we have huge number of talent within IT industry which are actually practicing AI, machine learning, and all these emerging technologies at large, and doing work with their clients from all across the world. All these technology platforms which are being developed in the field of IT are somewhere getting support, talent support from Indian IT services industry. And given in this background, I'm very sure that if Indian startup ecosystem gets the right kind of collaboration, right kind of input, right kind of insight from the experts, and a preferable and supportive ecosystem from Indian stakeholders, India is going to be, a very huge market. Not only huge market, it is going to be a huge, um, knowledge base where all these technologies will be used with a lot of cost arbitrage advantages, because using this technology becomes so costly in other geographies. In US and European geographies, using this technology is so difficult. You have to pay higher cost, huge amount of wealth you have to place for that. Within India, you have talent, you have people who are doing that, and therefore, if you develop technology within India to do things, you will be able to develop those platform in a fraction of the cost and in monies that you have to put in comparison to your counterparts, those who are developing technology in US and Europe. With these few words, I must thank Professor Dr. Derek Lomas for being with us. I am DG STPI in my own capacity, and also in the capacity of the Chief Executive of my organization. I welcome him, and I must communicate or convey my gratitude towards him for being with us. I am very keen to listen to him. He is an expert, and we all are here to get some guidance, some insight from him in the it's a very important aspect of technology. Thank you very much.
Okay, thank you, Dr. Rai, and delivering your enlightening views on this healthcare sector and application of AI, machine language, and robotics, etc. And it is well known that prevention is always better than cure, and you have emphasized on the same thing that AI can help, can add for preventive kind of health care for the people, and it will save lot of money as well as time, and will make the life more better, more easy than the life when this AI application of AI or machine language and robotics are not there. And you have also emphasized on the importance of data, that this data which doctor are getting through patients in various clinics and hospitals, but these data are not being collected right now. So we now need to develop some kind of mechanism so that this data can be collected and further research, further analysis can be done on these data for developing application and devices as per the result of those data. And you have also mentioned that few organizations like Amazon, IBM, they have platform where they are now collecting the data, and it is a need of time that India should have also developed that kind of platform in India. And I will come back later on after listening Dr. Direct views on this particular topic, AI for well-being. And before handing over this session to Dr. Derek, I will like to read his brief profile for the benefit of all our audience and listeners. Your battery is running low, yeah. Dr. Lomas JD is presently working as assistant professor at Dell University of Technology, and also is director of Play Power Labs Incorporation. Before moving to Dell, Derek Lomas received his postdoctoral training at University of California, the UC San Diego Design Lab with Donald Norman. He has a bachelor degree in cognitive science from Yale University, a master degree in visual art from UC University of California, San Diego in 2009, and a doctorate in human computer interaction at SCI from Carnegie Mellon University in 2014. He won a PopTech Social Innovation Fellowship, a MacArthur Foundation Digital Media and Learning Award, a CSAM Workshop and White House Impact Award, and is an alumni of TechStars. He runs a design consultancy, playpowerlabs.com, which provides education companies with design, data science, and software development services. He designs data-informed smart system for human well-being, bringing humanist values into AI system. He is a classist futurist, cognitive scientist, and proponent of the magic of resonance in design. Lomas has produced over 40 learning and assessment games that have been played by millions of children. His design consultancy, Play Power Labs, provides UX design, data science, and software development services. He has worked on various projects such as Neuro UX, Gensus, FactFlow, and Vive Research Labs. Now over to Dr. Derek Lomas, and we would like to listen your views on advanced researches in AI for healthcare sector, as well as the contemporary research in this particular area. And we will also like to know your views how India can benefit from this application of AI, as in India we see that we have only 1.5 doctor over 1,000 population. Over to Dr. Lomas.
Thank you very much. I'm extremely pleased to be here, and it's a great honor. Let me check first. Can you see my screen?
We are able to see the presentation on the screen.
Okay. Okay. Well, I wanted to start off with appreciation for the STPI organization headed by Dr. Suresh. Gift City has been an amazing place for Play Power Labs. This is actually our 10-year anniversary, and we've been based in Gandhinagar from the beginning, from students at the Dhirubhai Ambani Institute for Information and Communication Technology. I'm very happy to be sharing this with you. This is a story about the human side of AI, and I believe that there'll be something for everyone in this presentation. There'll be theory, practical advice, and a lot of examples that I hope can shed light on some of the different opportunities. So in a nutshell, this whole story is about the importance of developing measures of what truly matters, and having an optimistic view about our ability to improve things for the future through optimization, and the critical advice that we must keep our humanity as we do this. This isn't just a matter of artificial intelligence. Any kind of system that is too inflexible in its algorithmic implementation can run the risk of dehumanizing the people that it engages with. So recently, Dr. Effie Vallena has put together these 5 core principles of ethical AI, distilled from some 70 different principles that she found in the literature. They're quite simple. Do good, don't do evil, act fair, be clear and understandable, and support human control. These are all very important principles. The topic of this talk is the nature of the good that we're optimizing for. So a couple of years ago, Mark Zuckerberg made some changes to the Facebook news feed, which is a everyday artificial intelligence. And he said that the revenues were going to be decreasing slightly because they wanted to make changes that would improve people's experience and hopefully contribute to their well-being. So he said, we feel a responsibility to make sure our services aren't just fun to use, but also good for people's well-being. Well, this is greatly appreciated that it's coming from such a person, but I think he's got his hands full. There's a lot of work to be done to make sure that Facebook is actually good for people's well-being. Just the other day, in light of the COVID-19 lockdowns and the protests in the States over police brutality, Don Norman, my mentor, sent out a message that our ideas have to build a long-term future to offer solutions for ways to address hunger, poverty, racial prejudice. We need to get rid of the GDP as a measure of success and replace it with measures of wellness and satisfaction. This is somewhat controversial, though it's not an uncommon idea. We spend so much effort in improving wealth based on certain measures, but those measures of wealth don't capture all of the things that we truly value. We need to have artificial intelligence systems that are good for humanity. These systems are being developed, they're extremely powerful, and there are many different ways in which they can subtly, even insidiously, undermine our humanity. And it's something that we need to pay attention to as an existential threat to the way of life that we know it. One of the key issues is that AI systems optimize for numerical metrics. I'll go into this further. This is somewhat controversial statement, but not really. You'll see who's backing this up. And the challenge is, how then can we translate our humanistic values into numbers, into metrics that are readable by AI systems? And this is critical, because otherwise we could find ourselves optimizing for something that we don't, in fact, believe to be the source of value. I came across this quote the other day, and I thought it was a really beautiful quote. This is from the first Prime Minister of India. He said, "The old philosophers were ever seeking this, and even modern scientists are impelled by this urge. All our schemes and planning, our ideas of education and social and political organization have at their back the search for unity and harmony." It's a beautiful statement, and I would challenge anyone to figure out how to create a metric for this that an AI system could understand. So this is our challenge. How can we optimize for this harmonious future with artificial intelligence? So first, what is artificial intelligence? I like the sad robot because we tend to associate artificial intelligence with robots and with other human impersonators, but usually AI doesn't look anything like a person. These are some examples of AI that you use every day, from Google search to Facebook or Instagram, recommendations on shopping sites, any online advertisement that you see, whether you want to or not. Fraud detection. Whenever you make a purchase, there are AI systems that are analyzing that purchase for potential fraud. And increasingly, security cameras are hooked into facial recognition systems. Voice to text is nearly ubiquitous. I can't be sure right now, but I'm pretty sure that YouTube is transcribing what I'm saying right now. And then one of my favorite examples of everyday AI is autopilot. Not the autopilot in Tesla, though that's an incredible technological feat, but the autopilot that's found in planes. Because this is an artificial intelligence that is indisputably artificial intelligence, but it was invented in 1914. And that helps position what artificial intelligence really is. It's not just a set of machine learning algorithms, although they are incredibly powerful. There are a range of different fields within artificial intelligence: computer vision, natural language processing, the use of sensors and Internet of Things, manufacturing, robotics. But by and large, the majority of the everyday AI is based on general optimization algorithms. So if we think about what intelligence itself is, these AI researchers Shane Legg and Marcus Hutter synthesized 70 different definitions of intelligence from artificial intelligence literature as well as the psychological literature. And they came up with this, not terribly controversial: an agent's general ability to achieve goals in a wide range of environments. This is a sort of stupid is as stupid does definition of intelligence, or smart is as smart does. If a system is able to achieve its goals, then we must say that it's intelligent. So this definition comes from Peter Norvig, who is the director of research at Google. And he defines intelligence as the ability to select an action that's expected to maximize a performance measure. And I think that this is cutting to the heart of the matter, because artificial intelligence needs measures. So we often think of the beginnings of artificial intelligence from the beginnings of computer science in, say, the 50s and 60s. But really, the origins are Norbert Wiener's notion of cybernetics, these perception-action feedback loops that allow a description of living organisms as well as technological systems to assess their environment and take actions that are adaptive. I think about this as measure and modify. This is something I use with clients. We try to identify what are the outcomes that you're looking for, what are the measures that you're able to obtain, and then what's the possible action space that you can take in response to those measures. Defining those out may seem trivial, but it's extremely powerful. Another way to say it is you want to identify the areas of need, and then you want to do something about it. And this is really at the heart of intelligence, both in living systems and in artificial intelligence. So I like to call this smart systems, because the purpose of artificial intelligence is to be useful. It's not to replace people. It's not to be artificial. It's to be useful. And so insofar as people are able to contribute to the intelligence of the system, we shouldn't view the system as just the machine system, but as the interconnected system of people working with machines. And in all cases where data, assessments, information is used to inform improvements. Again, I like this Forrest Gump reference: smart is as smart does. You want a system that achieves the outcomes you're looking for. So I'm going to play a video.
The dictionary defines it as the ability to live your life without being helped or influenced by others.
It could also mean the ability to discover a whole new recipe.
Chicken and pumpkin soup.
Soup ingredients:
It could also mean submitting an assignment just before the deadline.
It could be sharing a laugh with a colleague near the coffee machine.
Looks like Alex from finance.
To step out for some fresh air and roam the streets without any worry.
Looks like a body of water running through a grassy field.
Or just managing to catch that train during rush hour.
1541, Sprinter, Amsterdam Central, via Mariahof.
To be able to sort and read my own letters.
Credit card statement, Post Box 289.
To be able to pop quickly into my favorite local store.
Mango chutney.
It is to know that when I get stuck, I have people to call upon.
Hey, yes sir, where are you?
Hey there, there seems to be a roadblock here. Can you help me out?
I can help you out. Do you want to use like a road map or something?
Okay, wait, I'll share my location.
All hands meeting. Tulip 3 meeting room.
Tulip 3.
To be surrounded by great people and be surprised by their love.
Looks like a birthday cake with lit candles.
To cook my favorite meal that my lovely family can't get enough of.
To push my physical limits. To move, to jump, to punch, and to feel alive.
I wish you the happiest year ahead.
To be me. To be Parham Dustar.
To be me, to be Jesse Wienholz.
To be me, to be Joy Barry.
Introducing Envision Glasses, the new AI-powered smart glasses by Envision, empowering the blind and visually impaired to be more independent. Available for pre-order now.
Okay, so this I think is a very beautiful human-centered design AI project that was conducted by one of my graduation students for CoEnin. And these glasses do work, and they are available for pre-order. The key illustration here is that as great as computer vision can be, it will fail, inevitably. And the genius of this project was being able to integrate not just the computer vision, but to integrate a person's own social network so that they could contact a friend or a paid assistant to look through their own eyes when the computer vision fails. And so this notion of how a smart system can allow for the intelligent integration of human intelligence and artificial intelligence is, I think, a really crucial point. So I'm going to briefly take you through my own design journey. I think it's going to be helpful to communicate why I have the position I do. So this was, let's say, 2007. I took an internship in Mumbai with Qualcomm. I was living in Southern California, and this was the furthest I'd ever traveled from home, and the project was incredible. It was about the adoption of the next billion computer users. So we think of computers as laptops, etc., but this recognition that a billion new people were about to be using computers in the form of mobile phones was mind-blowing. And so this was an ethnographic design research project to understand some of the varying needs that people would have as they gained access to phones beyond the feature phones that they had. And as part of this project, I spent a lot of time in the electronics markets in Mumbai. This is Lamington Road, where you can find capacitors or resistors sold like spices. Again, mind-blowing for me. And I kept on getting pitched this $15 computer, which I thought was just strange. I didn't know what to think of it, especially since it was sold with a gun. So I kept on seeing this computer, and I realized that you could bargain and get them for only $10. And it used a television as a screen, and it came with all of this preloaded educational software, everything from teaching typing to music composition, even programming in BASIC, a specialized version of BASIC for making your own video games on a $10 computer. This was at the peak time of the One Laptop Per Child project, which had the assumption that if you could just make computers cheap enough, the education would follow. And what this experience showed me was that computers would be cheap. There would be plenty of computers available. They might be secondhand, but there would be computational power available. The question is, what is the content that would be available? And besides Duck Hunt, of course, that's why there's a gun in the computer. I grew up with 8-bit educational games. I had a very good experience. And with my team at PlayPower, this was right when we got started with the MacArthur Digital Media and Learning Grant. We developed 3 8-bit games for this platform in collaboration with students at IIIT Hyderabad. And they came up with the game concepts, and we got the first 2 of them fully developed, Hanuman Typing Warrior and Hanuman Science Adventure. And the third one is SWAT Force, which is a game about malaria prevention. These 3 games were looking at creating high-impact skills at scale through low-cost, engaging educational technology. Now, of course, 8-bit games are not really the future. Mobile phones are certainly the future. And as this project got going, I realized that what was most important to me was being able to develop the software and the designs so that they actually worked. How could I know that the software that we were building was actually effective? And so I did my PhD at Carnegie Mellon with this focus on artificial intelligence, social impact, and what I call funology. Because if it's worth doing, it's worth having fun doing it. And I think that this is I think this is true. I think this is true. So over the years, we've built a lot of different video games for learning. And this is an example. When I started thinking about funology, I was imagining how we would measure how much fun the games were to play, and was thinking about what sorts of biosensors might allow me to measure the fun. It turned out that measuring fun was really quite easy. It was simply how long people would voluntarily play the game. Well, that's not exactly fun, that's engagement. But when it came to educational game design, that's what we were going for. We were trying to engage students voluntarily in playing. And so across all of these different games that we produced, we wanted to figure out how could we more effectively measure whether the games were effective. And so we looked at what was going on in online product experiments. So this is a typical practice for all of the major tech companies, where they'll run A/B tests. They'll have a set of different designs, and they'll randomly assign them to users. And based on that random assignment, just like a scientific experiment, they can then determine which design caused the best outcomes. And tens of thousands of these experiments are being run every day. And it got to me, why were we only using this powerful technology to optimize advertisements? And could we potentially be optimizing something more meaningful, like education or even human well-being? So in this particular game, we wanted to explore how different design factors affected how long students were playing. And so I turned to the theory of Mihai Csikszentmihalyi. It's a great name. And you might be familiar with his concept of flow. So getting into a flow state is really wonderful. It's something that is just as likely to happen at work as when you've got free time. It's when you're wholly consumed with the task at hand. You're not distracted by anything else, and you're doing your best. And Mihai Csikszentmihalyi conceptualized this as a balance between challenge and ability. So if it was too easy, people would be bored. If it was too hard, it would be anxiety driving. But if it was just right, it would be fun and people would be in the flow state. So we wanted to test this idea of not too hard, not too easy. And so we created an experiment with over 14,000 different experimental conditions and over 70,000 participants, because we had several thousand students playing these games online every day that gave us this incredible capacity for experimentation. And we hypothesized that at a moderate level of difficulty, we would see the maximum motivation of students. And while this was the theory, what we found in practice was that the easier the games were, the longer people played. And this resulted in a set of other experiments. The story is that people like to be successful so long as it's new. So not too hard, not too boring is maybe a better way of describing the flow state. But the point here is that with these A/B tests, one is able to take the theory of learning, which you use to design educational software, and then once that software is at scale, you can run these controlled experiments that either directly improve the educational outcomes, like those advertising A/B tests, or help contribute to improved theories of learning, which can contribute to this feedback loop. And this overall approach of how theories can lead to designs that, when at scale, can be tested to contribute both to science and to direct optimization, I think is a really beautiful phenomenon. And I'm very thankful that the Bill and Melinda Gates Foundation and the Schmidt Family Foundation have provided funding for PlayPower to build an open source A/B testing platform for educational software in collaboration with Carnegie Learning, one of the world's leaders in adaptive educational software. So with about 5,000 subjects every day showing up at our online laboratory, we could run thousands of experiments every year, which raises this possibility of artificial intelligence accelerating the science of human motivation. Now that's a place to pause, because I'm not sure if you're familiar with Yuval Noah Harari's work, but he's been talking a lot recently about the threat of hacking humans. The idea that through just this sort of experimentation and artificial intelligence, that we can achieve large-scale social control. Well, not us, but people with the money to do it, have the potential ability to direct us towards areas that are not in our best interests. And so this, I want to highlight some of the risks of this as well as the opportunities. And indeed, our approach of embedding artificial intelligence into the game to automatically optimize the design space to improve student motivation was successful. And we showed that this algorithm allowed us to increase student motivation by over 30%. But then it spun out of control. So here's what I mean. This was optimizing for how long students were playing, and that's it. And what we found was that we started getting phone calls from the company that we were hosting this through. They told us there was some bug in the game. We went and checked it out, and sure enough, the targets, those ships that you're trying to hit on that fraction number line, had taken up almost the entire screen with these huge explosions. And it was just clear on the face of it that the game no longer had any educational value at all. But students were still playing it more than before. And so this is the example of why you don't want an artificial intelligent system to optimize for something that isn't exactly what you want. So we learned that AI can very easily optimize for the wrong thing. And to account for that, it's really important to design for the people in AI systems. We shouldn't think of AI systems as fully autonomous. We need to create interfaces between those systems and the people running them that are effective, that can make sure that there's a strong connection between the experience produced by the AI and the data that's coming out. Because all that we saw from our dashboard was that the AI was working. The numbers were going up, but we weren't connected to the experience of what it was actually deploying. The third thing we learned is that it's critical to continuously align the metrics we're using and the values. It's not something you can just pick once. It's something where there has to be a continuous discussion of what are the metrics that represent the values that we really care about. So to provide a little bit of background for the theory of AI for well-being, at the Delft Institute for Positive Design, run by Peter Desmet, there has been a model for design for well-being that consists of design for pleasure, design for virtue, and design for personal significance. So in other words, design to make you feel good, design to help you be good, and design that makes life meaningful. And this is one of many models, but it's a particularly powerful model, Marty Seligman's PERMA model of well-being, that consists of positive emotions, engagement, relationships, meaning, and accomplishment. And by model of well-being, I mean there are questions that you can ask people about these factors of well-being that strongly predict whether a person will respond positively to the question, how satisfied are you with your life? So if we look at smart systems for well-being, where we want to assess and adapt in a learning loop, the algorithm for AI for well-being is quite simple. We want to measure and develop measures of our values. We want to build optimization systems that allow us to measurably improve those values. And we need to make sure that we don't lose the human touch. We have to keep our humanity as we engage in this optimization. And this is a tension, and it's not a tension where one should win and one should lose. Metrics and numbers are critical, and they will be used. AI will be used for optimizing money making. I can guarantee it. Whether or not it will be used to optimize other values is a question of whether we invest resources in designing it. But even once there are strong computational systems for optimization, you still need to have the human value, the qualitative, the experiential to come together. And at Delft, based on the theory of vision and product design by Paul Heckert, the notion of a product vision, having a visionary quality that's more experiential and metaphorical, that can act in concert with goal-driven design approaches, is extremely powerful. So now for some more examples before I close up. So first of all, NeuroUX is a subsidiary of PlayPower Labs now, and this was started a couple of years ago in collaboration with psychiatry professors at UC San Diego that were looking for better ways of collecting data about psychiatric patients, patients with bipolar disorder, schizophrenia, or Alzheimer's disease. How could the mobile phone be used to capture measures that would inform more better treatments? And so this the goal here is really to improve the efficiency of measurement. So you don't have to bring people into a laboratory. It's something that you're able to do over time at a lower cost to treat serious mental health challenges. And this project has sort of borne fruit with our initiative around addressing one of the biggest challenges with the COVID-19 pandemic, which at the moment is less to do with the people who are sick and much to do with the people whose lives have been radically changed. And the number of people who are struggling, where we do not understand the nature of their struggles, is astronomical. And so the concept was, how could we provide an anonymous service for people to share their voice about their own well-being? And in order to support well-being during COVID-19, we first need to understand those needs. And so this is a website, and I'd encourage you to go there now, mywellnesscheck.org, and sign up. It takes 5 minutes, and this can help us to understand how well-being is changing over time. What we're working towards is a sort of weather report of well-being in different communities, both at scale and at large, but also for particular organizations, to understand how their staff are doing, how their students are doing, how their patients are doing with a human touch. And so in My Wellness Check, there's a range of different questions that we ask, and we're constantly experimenting with different types of questions to get at the factors that underlie people's challenges. And in the first month, we got a total of 1,200 responses. And one of the pieces that I'd like you to notice in this question, I am satisfied with my life, is that there are a number of people that are not satisfied. And we collected data on a number of different attributes, including behaviors like sleeping and exercising and eating. And now what we're doing is we're building a feedback loop between what some people have provided as tips and recommendations around well-being back to the users that are participating, in conjunction with official mental health resources from the World Health Organization. And again, that's at mywellnesscheck.org. This project actually came from a personal experience that I had when my father was dying of cancer. And he was being treated in Cleveland Clinic and had access to some of the very best medical care available, immunotherapy, these cutting-edge treatments. But I was frustrated that his doctors didn't seem to be aware that he wasn't getting any exercise. He was having a very hard time sleeping. He didn't really even have the energy to watch Netflix, and you know that's got to be bad, or see friends. And seeing friends, having the vitality to move around, these are both inputs to a cancer treatment, and they're also the whole point of it. And so the goal with this was to create an easy way for doctors and hospitals to check in on their patients about these critical factors of well-being that aren't always asked about. So now on to some other student projects. The Mood Light is a smart night light to help families talk about emotions and track emotions. So I don't know if you've got any young children in the house. I have 3, and kids' emotions are real. Family emotions are very real. And this is a light that let kids express their emotions, particularly their negative emotions, and keep track of them. And it's used in conjunction with an app, and critically, in conjunction with parenting practices for talking to children about emotions. Fact Flow is another smart system that links the intelligence of parents with an adaptive algorithm. So the adaptive algorithm keeps track of the math facts that a student is struggling with, And the parent provides the critical emotional intelligence to coach their children through math fact practice, because it's not easy, believe me. I've got an 8-year-old daughter, and it's a continuous challenge to get enough practice. Then here's another medical project which has to do with sleep. Sleep is a critical factor in human well-being and a critical factor in recovery, and it's a major challenge. And so this uses rhythmic vibrations that go up and down a weighted blanket to help people fall asleep faster. It's a beautiful project, and in an initial pilot, very promising results. This is another pilot project called Reset, and it's exploring how EEG-attuned light pulses can disrupt negative repeating thoughts, which are associated with depression and burnout. And so the idea here is that we use EEG to measure a person's individual peak alpha frequency. The alpha brainwave is the strongest and most dominant brainwave, around 10 hertz, but it varies between people. And so we measure an individual's peak alpha frequency, and then we play back these flickers of light either at that frequency or an offset. And this is a really fun project, and we're starting to collaborate with IIT Gandhinagar, with Krishna Prasad in the Cognitive Science Department on this. And also with Krishna Prasad is another project where we've been looking at using biosensors, namely EEG, to predict a person's enjoyment while listening to music. And this is a real challenge, I'm telling you. So we're using convolutional neural networks with 128 channel array of high frequency EEG, and we're trying to predict the enjoyment that a person's having in order to create a brain-based metric of positive experience. Now, I have a feeling this is a 20-year research objective, but it's already been extremely productive. Also on the medical side, you may be familiar with some of the non-drug treatments that are coming out of MIT for treating Alzheimer's with 40 hertz stimulation. So Alzheimer's patients have a reduced coherence in the higher frequency gamma brainwave, and they've shown successfully in mice that 40 hertz light and sound stimulation reduce Alzheimer's symptoms in mice and improve cognitive function. And so this project has been about creating the user experience for such a treatment with adults. And as part of this, it's tough to have a blinking light over your eyes all the time. Similarly, to be listening to a 40 hertz tone all the time is a real challenge. And so what we've been exploring is instead using whole body vibration at 40 hertz to provide this rhythmic entrainment that may have this positive effect on mild cognitive impairment and Alzheimer's disease. And the best part is it feels great. And so this is a project where we've been looking at optimizing the aesthetic response to whole body vibration. And this was shown this past year at Dutch Design Week, where we're using various approaches to capture people's aesthetic response and optimize. And a smart wheelchair. So here's another example of where we take factors associated with wheelchair user well-being, and we use machine learning and sensors to measure those factors. And so proper posture while sitting in a wheelchair predicts recovery times. And so does the use of light exercise in the wheelchair. And so those behaviors are associated with wheelchair well-being. We developed a machine learning model with these sensors that can identify those behaviors and then feed that into an app that supports personal improvement. Okay, so there's a nice collection of real-world AI for well-being projects. So now some caution. I'd say that the most important thing to know is something called Goodhart's law. And this is the idea that a measure that becomes a target ceases to be a good measure. Well, that's a bit strong, but the basic idea is that when you know what the target is, there are a lot of different ways in which the system can game the measure. So for instance, in the National Health Service in the UK, there were a number of efforts to introduce key performance indicators, KPIs, associated with hospital efficiency. And rather than reducing the amount of time that patients were waiting in the waiting room, which was the goal, they found that instead the hospitals slyly renamed the waiting room the pre-patient administration area. And so the waiting room time was decreased, but not for the right reason. And so these types of games in systems that are defining people's jobs and livelihoods must be expected and require that continuous alignment that I was talking about. Another key caution is that this is not just about technology. This is about policy. What are we trying to optimize for? And what are the values that we're bringing to bear? These are philosophical questions. These are political questions. And it's not something for a technology to just figure out on its own. It takes the hard work of engaging with each other as people. So in conclusion, again, this talk is about the possibility and the opportunity to measure what matters in society, not just GDP, but our well-being and happiness, and to do so within particular domains of healthcare, of education, of civil society, of our employees, of our students. We should be measuring well-being because we should be optimizing it. In the States, we've done a lot of work on the effects of poverty on educational achievement, and it is depressing at times to see what a strong effect there is on a person's trajectory. And one thing we know about poverty is that it's not just about money, it's about deficits in well-being. And this is a way to orient society to help those in need. And so the key message of this in entirety is that we need to stay human in our efforts to optimize. We shouldn't just turn it on autopilot and hope it works out all right. And so just in a final note, coming back to Nehru's quote on harmony, I've been spending a lot of time in this area looking at frankly, hundreds of different philosophers and theorists that have dealt with this concept. And recently, a study of over 3,000 people around the globe looking at layperson definitions, so man on the street definitions of harmony, of happiness. And the number one factor that came out, whether it was in South America or India or China, was a notion of inner harmony. And measures of unity in diversity, which is a great way to describe what harmony is, unity in diversity, that beautiful thing. These measures have been developed for monitoring ecosystems, for monitoring markets, for social networks, and there's a lot of opportunity in the future for applying this even to things like biosensors. So well-being has been invisible to AI. And hopefully with this presentation, we can start the process of ending that now. So I really appreciate your time, and I look forward to any questions, and I encourage you to send me an email at the address on the screen.
Yeah, thank you very much, Dr. Derek Lomas, for a comprehensive but a precise kind of informative and educative kind of, I will rate this as a lecture kind of thing, where you have given a lot of inputs with regard to theory, different models which are being adopted in well-being, and where AI has a very critical and crucial role to play. You have also covered computer vision, language processing, cybernetic, which helps in assessing the environment and accordingly adapt the responses. That is a kind of thing which we should know. And you have very well said that we should use what we require only. That is the we can say is a way to deal with the environment and resources. And at the last, you have also mentioned that it is not the money which measures the well-being, but it is the deficit in the happiness, which is very important for the well-being. And besides, you have told about the productive pension, PERMA model of well-being, and I'm happy to know that AI can help in such area in a big way. And by seeing your experience and association with IIT Gandhinagar, where you have mentioned briefly about a number of projects being undertaken under your guidance or have been completed. So we hope that in future we also take your association, your help, your guidance, your advisory kind of services when we will start our this center of excellence on medical devices and technology. And with this, now I invite audiences on the session to ask question. If audiences have question, they can raise. There are few questions which they have posted on the dashboard also. So I will go to those questions first. I will take one or two questions because we have already left all the time and we have crossed the limit. So now I will take only one question if somebody raise hand. Otherwise, I will go two or three questions which have been asked on the dashboard. Over to the audiences for asking the question. Somebody has raised hand. This is Ankit Sukla, Dr. Vetrozen Healthcare Services. He is requesting for mic and raised hand.
Hello.
Yes, Ankit, now you are enabled on the mic.
Yeah, hi, can you hear me? Hello. Hello.
Yeah, you are audible, Ankit. Please go ahead.
Yeah, hi, the question is for Dr. Derek. So thanks a lot for this really good talk. I was just wondering, like, for this healthcare and well-being AIs, could you actually use the knowledge that you have gained within these well-being and healthcare AI apps and use transfer learning to sort of use the parameters that you have optimized in these projects to other areas of medicine? And also I want to know, like, for the healthcare and the well-being AI, how big does the data size need to be? So how many subjects you need to sort of measure in order to come to some sort of a definitive conclusion? And also the last question that I had was that for healthcare AI in diagnostics, so for example, a lot of AI systems are being developed for COVID-19 diagnosis, and all of them mostly, like in a number of areas of healthcare, they always rely on doctor diagnosis reports. So like they're optimizing for radiologist reports and stuff. But the problem is that we already know that there's a huge variation in the reading of the doctors. So the same radiologists looking at X-rays or CT scans have different sort of opinions. So how do you sort of account for that variation within the AI algorithms?
Well, thank you for your question. So the idea of the relevance of this to existing systems, the size of data that's required, and how we can have diagnostic systems when the doctors themselves are not always in agreement.
Yeah.
So I think that last point is really critical, and I think that shows why a smart system viewpoint can be very practical. No doctor that I know of wants to have their diagnosis replaced by a diagnostic system. Instead, doctors want to use those systems to inform their diagnosis. Of course, it's an entirely separate talk to describe some of the many diagnostic systems, computer vision systems in healthcare that are truly revolutionary. But I think the key point from this talk is that those systems should work with doctors as tools that can allow them to be more efficient and have a broader reach, and not be viewed as something that is somehow replacing them. They're tools like anything else. And I'll address the second point of the amount of data that's required. For these types of systems, we very rarely collect any data today on psychological well-being of patients, or the behavioral factors of things like exercise and sleep, eating, seeing friends. These things have a huge impact on our treatment outcomes, and they can indeed serve as targets for how other much richer data sources, so more rich data sources can predict patient well-being as an outcome. So it doesn't take a lot of data collected from people about their well-being before all of the other data sources can be brought to bear upon it. Thank you.
Okay, now I will take just 2 or 3 quick questions which have been posted on the dashboard. First question, which will I take from Subodh Sachan, Director, STPI. This is basically on the application of best practices, what we are adopting in Europe. He has asked, there are challenges in terms of data and models and its adoption. How European countries are handling the same?
Yeah.
Over to Derek.
Yeah, thank you for the question. If I interpret this question correctly, the question of how the data sources and data models can provide challenges and opportunities for different AI systems and algorithms today, because anyone who's in this field knows that the data is not all in the right shape. It is 99% of the job to clean things up. The models themselves are relatively straightforward to run, but running them requires that the assumptions of the model are met. And so my experience has been, our experience in working with other large customers in education that have similar challenges with data integrity, is that auditing data, getting a human handle on data, having people on the ground who really understand how the data is being generated and that the assumptions embedded within the system is critical for the use of any of these more cutting edge AI systems. Absolutely, we should be enthusiastic about their power, but we should not be, we should not believe in magic. We should absolutely keep the systems accountable, and I think the best way to do that is with good old-fashioned data science and feet on the ground.
Thank you, Dr. Derek, and you have very rightly said that it is a huge work to extract data among the humongous data which is available and to analyze that and to convert in information, and there are number of models are being used for that purpose. Now I am going to another question which has been asked by Mr. Deepak, founder and CEO of Sky Earth Labs. How to explore design of hardware device while building smart devices of healthcare. Can you share some important resources to get started with hardware? Yeah, over to Derek.
So in what domain of hardware? Just in general in
the healthcare sector. He is asking specifically for healthcare sector.
Okay, yeah. Well, I mean, there are a lot of different hardware domains, but if this has to do with measurement, if it has to do with how to use hardware in a hospital setting for gathering measures, I would say that the biggest challenge is the integration with existing data systems. And I can think about resources. The UC San Diego Design Lab has had some engagements on this, really in the complexity of integration, the integration challenge, where there's so many different data systems, and any new piece of hardware isn't going to be the whole system. It's going to need to fit into an existing ecosystem, and that takes a lot of work. And I'd say one other just comment on this, which is we've started looking at a new source of hardware for data collection in education, which is paper. So paper, a lot of people think that paper is going away. It's not going away, not for decades, maybe never. It's useful, it's cheap, it's available, and it's surprisingly robust. And I think a more important challenge is figuring out how to fluently get the data from the paper. And so that's an example of an unusual type of hardware for data collection in medicine as well, which is paper.
Thank you very much, Dr. Lomas. This is the last question which I am taking for you only. This Soumya Sukla, co-founder Vectrozen Healthcare Services Private Limited. She is from the same company from where this Ankit Sukla was there. She is asking that what is your take on AI in healthcare diagnostic to engage in better precision medicine and hypothesis-free diagnosis?
Yeah. So this is a question that I'd love to pass to a friend of mine, a MD PhD at UC San Diego in the Design Lab. He's done a lot of great work on these model-free diagnostic systems, and I'd be happy to pass him on. His name is Dr. Eli Spencer.
Okay, now this questions answer session is over. Now I will take this opportunity to express vote of thanks to both of the speaker. I take this opportunity to express my gratitude and sincere thanks to Dr. Derek Lomas and Dr. Onkar Rai, DG STPI. And I am also grateful to all the audiences who have participated actively in this particular session, and they have raised number of questions. So due to paucity of the time, we could not take all the questions and all the views of the audiences also. At the last but not the least, I will also like to thank our STPI team which is involved in arranging this kind of air meet. This year meet in such kind of COVID-19 situation. But this is an opportunity for us to meet regularly through this platform. And at the last, I will thank all STPI staff and senior people and directors to participate in this event. Now, I will hand over to Dr. Onkar Rai, DG STPI, to give some final comments and then we close the session.
Thank you very much. In fact, I am very delighted, and I am very sure the audience that we have our STPI colleagues from all across the country, and the industry representatives, participants, they had a great presentation from Director Derek Lomas. And since India is trying to do great things in terms of medical technologies and uses of AI and other technologies in healthcare. It's a very challenging area, and we are trying to build a lot of technologies, a lot of adoption of a lot of technologies, best practices, and all. This presentation of Dr. Lomas has actually thrown light in a very great detail about the whole uses of AI in not only in healthcare but in other sectors also. So I'm very sure that we all stand benefited from his speech, his talk, his vision. As Mr. Rajneesh Agrawal was expecting that STPI is trying to create center of excellence for promoting startups in various domains, including healthcare and medical technology. I'm looking forward for a collaboration with Dr. Lomas. I'm very sure that he will be happy to help us in some of our initiatives and try to guide our startups with his knowledge and wisdom. I must also thank him and thank Rajneesh Agrawal and his team.
Okay, thank you everyone. And now we